times whereby you go to the hospital, you see a doctor, and then you leave the hospital feeling like you did not really gain much, or your problem was not solved? You didn't get that satisfaction that you wanted. And I know most of the times you feel like, oh, the doctor did not do you right. Okay, so today I'm here to tell you that at times you may be responsible for that, and I'll explain. You can't come to the hospital to see the doctor and you are not prepared. You don't come with any information. You're not even thought about, why am I coming to see the doctor? What am I expecting from this consultation? What questions would I want to ask? You need to prepare for this, because one, you're not the only patient. Two, you can't come to see a doctor and expect to sit down in the consulting room for 2 hours when there are so many other people waiting. So in order to have a smooth, efficient consultation, and at the end of the day you feel good that yes, well, if you paid, that it was your money's worth of consultation, there are certain information you need to know. You cannot come to see your doctor would ask you a question and your response is, I don't know. Doctor, you should know. How am I supposed to know? When was your last menstrual period? I don't know. Okay, your complaint is heavy menstrual bleeding. Okay, when did this start? I don't know. Okay, how old were you when you first saw your period? I don't know. Okay, how many days did you used to menstruate for? And how many days are you menstruating for now? I don't know. So when every question I ask, the answer is I don't know, I begin to feel that you are not in need of a solution to your problem, because there's no way you cannot know. There's a difference. I feel that there's a difference between I don't know and I can't remember. I can't remember means I'm trying to figure it out, but I just can't. I get. But I don't know, for me it just sounds a bit nonchalant. So let's stop using those words, I don't know. So you're coming to the hospital, you're coming for a gynecological consultation, you are having issues with your menstruation. You need to sit down and think about everything concerning your menstruation, because your doctor is going to ask. He's a doctor, he's a medical healer, he's not a religious healer, neither is he a traditional healer. History taking is number one step in helping you or in reaching a diagnosis. If I don't know what your problem is, I do not know what test to request for, and it's unfair for me to just decide to request for every single investigation I can think of, because I don't know what is wrong with you. I always advise my patients to always have a copy of the investigation. You may do an investigation in one place, and for one reason or the other you have to go to another state and you need to go to the hospital. That doctor in that hospital does not have access to your investigation, and then you come with a complaint. So it's one of two things: he either does not do anything about that, or he would request for a repeat investigation, which is, again, the economy is hard. We can't just keep repeating scans, we can't keep repeating stuff. But if you have the investigation, I'm able to look at the investigation and it helps me to know, okay, fine, this is exactly what you have and this is exactly what I'm going to do for you. That's number two. Number three, we cannot be nonchalant. Investigations are written in English. You may not know the nitty-gritty, but there are certain things you should know. Oh, I did a scan 2 days ago, but I don't have the result. Okay, what did they write? What was the conclusion? So that conclusion part, you must always look at it and know it. And that's why I said just snap, so you can show anybody at any point in time and anywhere, and they can now continue with your line of care. You cannot be on medications and not know the names of the medication. Prescribed drugs, I don't know the colors of the drugs. And now that we have branded, unbranded drugs, so you can have the same drug, is blue, is white, is green, is circle, is triangular, is oval. So I can't ask you, oh, what drug are you using for this condition? I don't know. It is green. And you expect me to know all the green medications. It's not possible, Okay, how many times a day do you take it? Is it 250 milligram? Is it 500 milligram? I don't know. How can you not know? The first step in getting treated, actually, it starts with you. It starts with you being very intentional about being treated. And for you to be intentional about being treated, it also means that certain basic information you should know. You cannot be on medications and not know. You cannot have a drug allergy and you don't know the drug you're allergic to. Oh, doctor, they gave me one antibiotics one time, and after they gave me, I couldn't breathe. Seriously? Okay, what's the name? I don't know. How can you not know? And so what happens if I give you the antibiotics and then something happens? So you cannot know. There are certain things that once they happen like this, that name should be your middle name. That name should be everywhere you go. Oh, I react to this antibiotic, I react to this antibiotic. Because, anyways, let me not rant too much. I've said what I want to say. And what I wanted to say is that please, 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 when you're coming to the hospital and you want to receive the best of care, and you want to go home feeling like, yes, it wasn't a waste of consultation, please, please, please have this at the back of your mind. This is my complaint. This is what I want to achieve. This is what I want to gain at the end of this consultation. I should be able to ask my doctor, what is the diagnosis? What investigations do I need? What is the prognosis? What is the long-term implication? What happens if I don't want to do surgery? What are the other options? You have to be intentional. Thank you.